Good evening and many thanks for watching KTN. Welcome to this edition of Health and Wellness every Sunday from 6 p.m. to 7 p.m. where we have an opportunity to have conversations surrounding health, because right here we say your health is your wealth. Today we have a conversation to talk about matters to do with caregiving work. Many would call that certified nurse assistant. And to have that discussion with us is Paul Otang, who is a healthcare assistant and also a certified nurse. Gentlemen, karibu sana.
Asante.
You know, for a very long time, when we talk about matters to do with care work and CNA, many ask, what exactly is your role when it comes to matters healthcare?
Okay. It's come from certified nurse. It's many different names, but we do same thing. Okay. That's why we find some people call themselves patient attendant, some call caregiver, some call themselves healthcare assistant, and some call them certified nurse. For me, I'm a certified nurse who has trained and have the professional. So you see, it's a different impact. So once you get your degree or your diploma or your certificate, whichever way, it means a lot for us. So I can say many people doesn't know the work of caregiver. Caregiver is a work which is not easy, because I can say it's not easy because once we deal with patients, we deal with different patients, and you have to be trained because you cannot handle patient without knowing what you are doing.
All right. One would then ask the question that I've entered into a hospital. At what point then do I, as a patient, come in contact with a certified nurse? And so that at any given point, because, you know, where we live, once you get into a hospital, we just think of doctors, right? Maybe a nurse is when maybe someone is admitted, but take us through that. At what point do I get in contact with a certified nurse or a caregiver, pretty much?
All right. So where you get in touch with caregiver or the certified nurse is whereby the doctor, the certified nurse take the tax of the doctors or nurse, where the doctor wants you to take the patient through the imaging, let's say ultrasound. A patient comes and the doctor wants the patient to be done ultrasound, is whereby you'll meet with the certified nurse. And not only ultrasound, there's so many tasks like giving food to the patient. Like you find the patient who cannot help themselves, you wheel the patient to different department of the hospital because the hospital is big. So you find like the doctor wants you to take the patient for MRI, you're the one who will be taking the patient to MRI, you're the one who will go to pick the medication for patient to the pharmacy in the hospital, you're the one taking the taxes, which the doctor cannot take them. You are the one who take the taxes for the patients. So once you take the tax for the doctors and nurses, is whereby you meet with the patient and you talk to the patient, right? Like the patient can be told that you'll be taken to let's say for X-ray. So you will be called the one on duty so that you can take the patient to where he's supposed to be taken. So you can meet with the patient.
Yeah. You know, for a very long time, many have looked at nurses' work to be, maybe you can correct us if you're right or wrong. The work of a nurse has been overlooked for a very long time, you know, yet they are the ones who run the show in hospitals, like you've just laid it clear. That when, say, a patient cannot feed themselves, it is a certified nurse who steps in. When a patient needs medication, you're the ones who then take the prescription from the doctor and make sure that the correct dosage has been taken by the nurse. Correct as if that is the role that then is played by a caregiver.
So what I can say is that our big role in the hospital is to handle with the patient. You know, we are the ones who are with a long hours with the patient, talking with the patient. Sometimes you find the patient doesn't want to take medication. You cannot go and force the patient to take the medicine because the patient is always right. So you'll have to listen to patient. Why don't want to take the medicine? So you'll have to listen to patient. Why? So that you can see the way you can help the patient. And that's why we come in, because we are professional. So you tell them important to take the medicine and to tell the patient how it's good for you to take the medicine. But first you have to listen why he refused to take the medicine. Once you feel it's okay, what he says, you'll have to escalate to doctor or to the nurse who's on duty. That the patients that refuse to take the medicine, then the nurse will take from there, because I cannot make my judge, because my limitation is limited. So there's a higher person who can do that for me, so I can escalate to him, so that or her, to help me to do with the patient.
Yeah, you know, you mentioned something here that the patient is always right. You know, it's pretty much like the same subject that many entrepreneurs do deal with, where they say that the customer is always right. I've heard you just say that the patient is always right. What does that really mean, where we know that the doctor has come in, diagnoses have been done, if it's the tests have been taken, you've interpreted that, diagnoses have been given to a patient, but you find that a patient would in one way or the other not be able or not want to take this medication. Why is that phrase important, that the patient is always right? Why is that important in your facet, pretty much?
Okay. Through my perspective, the patient is right, because I can say this, like it happened yesterday, because for me, I'm working in theater, that the patient came for CS. So you're saying that she was saying that she's having 2 babies, which is twins. But under the file, we see that the ultrasound says that she's having 1 baby.
1 baby,
But the patient, she's refusing by saying that I'm having twins, because say that before I came for labor or for ultrasound, I was sick and I was in the hospital, and I was told that I am carrying 2 babies. Why right now I'm having 1? So the doctor who was taking the CS, he emphasized that we take the patient to the ultrasound first, we see whether the patient is right or wrong. So we went there and we did the ultrasound, and the outcome came that she's having twins. So we were saying that the patient is right. That's why the patient is always right. Because whatever is getting from the mother or for the patient, you always keep in the mind. Because what is being told is the one that keeps in the mind. Even if it's a small clinic, whatever is being told. That's why even me, the patient cannot call me certified nurse, cannot call me caregiver. They normally see us in scrubs, so they normally call us doctors.
Daktari,
So I'm the one say, Ma'am, mimi si daktari, mimi ni caregiver. But they refuse. Sometimes say that, let's call you just daktari. But according to you, because you follow the rules of the hospital, you have to say, I'm a certified nurse.
Certified nurse.
Yes.
Yeah. I mean, I want to ask, it's a simple question. It's a very short question, but I think it's critical. Can our hospitals, whichever cadre, level 1, level 2, level 5, 6, whichever the case, can our hospitals work without nurses or without certified nurses?
Okay, it's a tricky question, but I can answer it. The hospital cannot work without certified nurse, because certified nurse play a big role in hospital. If you come where I'm working currently right now, in Mama Lucy Kibaki hospital, it's a level 5, and you see as a caregiver there, which is a certified nurse, they pay a big role, because they come in an extent that, you may find nurse, let's say nurse are 2. We have medical side and we have surgical side. And there are 2, and they need medicine, let's say for a patient, or they want to bring patient from theater. The nurse cannot wheel the patient alone. He have to have assistant. Assistant is certified nurse who can help her or him to bring a patient from theater to the ward. Not we can say about medication. Maybe the patient needs medicine, and the nurse is one in the ward. He cannot, she or he cannot go out from ward without escalate for the covering. So he'll have to have the certified nurse for that he can go and collect the medicine. So the certified can be given prescription. Certified nurse can be given prescriptions go for pharmacy to bring the medicine. So the certified nurse play a big role, because he or she have to be there, because that's what it is. So,
the reason why I ask that question is because, you see, once, like you just mentioned it, when many of us get to hospital, all we see is a doctor. It is within you to then make it clear that I'm a certified nurse or I'm a nurse, and this is my role. And the reason why I ask that then, one asks the question, how do you relate with your peers? Your peers here being doctors, nurses, to ensure that there is seamless operation in hospitals. Because a doctor is there, nurse is there to complement the doctor, and the certified nurse is there to complement all of them, right? So how good is the seamless operation in hospitals, just so we understand why certified nurses are important, and perhaps then this will lead us to a next conversation where we can start appreciating the position that you play in our hospitals, and even then escalate it further to look at the loopholes that do exist in hospitals today, in government policies in the medical field, and how we can improve on that. So just take us through how you engage with your peers within the industry, and then we will get to other parts later.
All right. What I can say, the key is united.
Yes.
Once you are united and you are being trained and you are professional, you'll have to know that you have to work together, because the doctor needs me and I need the doctor. Now, same case with nurse. Nurse needs me and I need nurse. So the big key in the hospital, as I can say, we as a certified nurse, we do a lot, which people doesn't know.
Yeah.
We do a lot. In terms of, let me go back concerning talking about the patient.
Yeah.
You may find sometimes patient doesn't want medication, just want to listen, need someone to talk to. So we are the right people to have the conversation.
Yeah.
Like you have somebody who having mental problem, you can make a play, you can make funny thing, because we learn that the doctor cannot do that because the time is limited. He have a lot of patient to check in. But for me, I can have that time because the patient is under problem and I have to be with him or her to understand him. So I have to make something. I have come with something. That's why I'm saying certified nurse is important to the hospital, because their roles, they are playing the big roles in hospital in terms of many things, not only being with patients, because sometimes we find that we have to carry medicine from the
warehouse, pretty much.
Very true, very true. So to bring to the wards, we have to go and collect food from the kitchen. Sometimes there's some patient who have not get food and they are asking like, I need food, I'm hungry, something like that. So you cannot send the doctor, you cannot send the nurse, because you know the work.
So then, if that is the position where we find ourselves, that then this is a unified department, right? So doctors, nurses, certified nurses, and pretty much the entire hospital staff have to work together. One asks the question then, in terms of numbers that we find are certified nurses in the country today, because if you go to our hospitals, you'd find that a certified nurse has worked for very long hours, which then brings me to the numbers. So in terms of the loophole, in terms of not having enough and sufficient staff, what are we looking at? Do we have enough certified nurses out there who are able to complement our hospital?
All right. I can say that we have challenges as certified nurse in terms of we are working long hours, and you see, I can say the field which I've been working, so many hospitals I've worked, we have many nurses, we have so many certified nurses, but the term of being paid, or that they don't look for hours, because we do a lot, and what we get, it's small. But I would like to emphasize, if we come in the hospital, or we come in to check in certified nurse, in terms of us, like what we earning, what we do, like things like that, we are stressful, we have the challenge, because after all, we are there from for me, I'm coming, I normally go to work at 7:30, I'm in work.
7:30 in the morning?
In the morning. And to left in the work, it's like 6 p.m. to 6:30.
So that's close to 12, 13 hours?
Yes.
All right.
And if you look my earning, is not qualified with the hours which I'm working. So it's frustrating, but we enjoy the job, because we learn more from the hospital, and we get new things, and we finalize that once we deal with different patients, we find that we get profession, like doing wound dressing, different things, different from what you learn from school, because from school you learn something like bed making, feeding the patient, listen to patient, try to help the patient, things like that, things like that, cleanliness of the patients. But in hospital, it's different. It's out what we learn in school. So you find yourself that you'll have to learn, because you have to know, because you follow the policy of the hospital. So you have to learn. There's such things we have not covered in the school. But we in this hospital, you find yourself, we are in. So that when I'm saying that we are working a lot of hours and our earnings too little, it's little because I know the work is there. Even if you call another CNA, or you have another CNA here, the same scenario which I'm saying is the same what you'll tell.
So we look at the reason why you're pulling long hours. Let's start from that. Is it because you are few in the hospital? Because I want to look at, say, Mama Lucy Kibaki Hospital, right? You say it's a level 5 hospital.
Very true.
Which then that is a referral facility, if I'm not wrong, right? So if that's the case, then maybe you can take us through how many CNAs you are in there so that we just understand exactly what is happening, so that we can start having discussions around the numbers, you know, because you're pulling long hours. Is it because you're few, you have many patients to deal with?
Okay, what I can say, because we are working long hours,
Yeah.
like in my department, let me talk about my department. We are only 3 CNA.
The entire Mama Lucy?
No, not the entire.
Oh,
in my
your
department,
department,
in
yeah.
my department, we are only 3. So you see in 3. So when I come,
Where your department is theatre?
theater, yeah.
Yeah.
So you see in my department, so when I'm in shift in the morning, so when I'll be out, for another person will come for night shift.
Night shift.
So it means one will be off. So you understand that. So in other departments, I think there are 3, 4, 5. It depends which department you work. But in Mama Lucy, we have so many certified nurses.
Yeah.
They have been given their great opportunity.
I want to ask about your department, to be specific. Say it's in theatre. Approximately in a day, say whether it is CS or any other procedures that are taking place in the hospital, how many procedures are we talking about that you could handle in a day?
Okay.
Say today you're getting into hospital, so a minimum of how many patients that you've been there because you are on duty for those 12 or 13 hours?
Okay, it depends with the department, but for us, like looking casual emergency, they might brought their list. Also, labor, they might brought their list. So it depends. The doctor brings the MO brings the list of the patient who are going to have the CS. He may bring, let's say, 3 for starting, because you don't know how the day it is, or you don't know how the night it is. So it might be, we have 7 cases, different cases. You may find it's X-lab, you may find it's CS, you may find it's ectopic, different. It depends with the doctor, why he brings the list to the theatre. So sometimes we look on that. Not on certified nursing on that, but for me, there's a place called PACU, which whereby after patient has done the CS or the case from the case, so they bring the patient to the PACU. So the PACU is where we look the vital signs of the patient, we take care of the patient and monitor the patient before taking him or her back to the ward. Yeah.
You know, the reason why I ask that is because I'm imagining where you are 3 certified nurses, so in a given day, only 2 are working, because one is working during the day, another one is working at night. Right. And because of that, then I'm looking at the numbers that are coming, the stress levels that are there. And that alone, in my opinion, shows that perhaps we have few, because I can't imagine having 3 cases and as a certified nurse, I am in all these cases back to back. It's not making sense. So let's look at what you as a profession are doing to address the numbers, you know, demanding for more numbers, and number 2, demanding for better remuneration. When you talk about not being paid well, what exactly are we talking about? Because you have to compare the work that you do together with the other professionals that you're assisting. So that will be doctors, nurses, and yourselves. So when we talk in terms of percentage, I'm not saying that you tell me how much you're earning.
Very true.
But how bad is it? How bad is it? Because it has to make sense at the end of the day. How bad is it? And do you have a union as well? And what is your union doing to address and push for better remuneration for the caregivers?
Okay, as for me, I can say that certified nurse, there are not many who has been employed permanently. We are casual. Many of us, we are casual. So like for me, I've been employed by Mama Lucy Hospital as a casual. I'm not a PNP. Yeah. So what I can say, I can emphasize that we cannot complain because we don't have that contract with the county government. But what I can emphasize that is that we as a certified nurse should be recognized by the county, by the government, because the school already the school have been recognized that they're giving this course to such people, because we do a lot. And you see, like for me, I'm the one to bring the patient from where it's supposed to be to the theater, and the one to return the patient. You see, I'm the one to bed making the patients, the bed, to bring the linens, the bed cover, the bed sheets, so that the patient might be, he or she be comfortable with what I give. All those things is me. Bringing the medication, sometimes it's me. So it's not every day, but we have a day we're going to the warehouse to bring the medicines. So you see, it's challenge for us because I'm not complaining about the house, but it's challenge for us. At least we could get something strong, which can motivate us to do more. But we do more because it's working, it's a calling.
Yeah.
Being in hospital is a calling. It's not easy because you find people with different diagnoses. You find a patient accident, you find many cases which is different, but it's taking heart because it's a calling.
Are these conversations that you're having within the hospital? So you work with Mama Lucy Hospital. So now here's a conversation between you and the county as well, in terms of remuneration and better working conditions, and also just adding more stuff. Are these conversations that are ongoing among your space? Not just Mama Lucy Hospital, but a conversation among yourselves as CNAs to ensure that things do improve, because like where we live today, if what is happening in Nairobi is anything to go by, the Council of Governors know exactly the situation across all these hospitals across the country. So are these conversations that you're having among yourselves together with, say, the hospital, hospital management, with the county government through your union? And do you also have a union?
Okay, I can say we don't have, for me, I don't have union.
Okay.
And majority of us, we don't have union. Because when you say union, I know unions, it's something which help people. And I normally see they help nurses, they help doctors because they are under it. For us as certified nurses or caregiver or patient attendant or care assistant, we don't have union. And you see, we have groups which we normally emphasize. Like we challenge the county because governors employed the Green Army, those who clean the roads.
Yes.
We ask even the governor, because some of us, we have worked under county more years, 10 years, 12 years, but we have never get complimented from the governments, the county government to compliment us, even us to get to be on the payroll or on the to be PNP, because we are working under their institution and we are deliver. Because they have to look on us also. Because we are human beings also. We have family who depend on us. And things sometimes they're tough for us. And that's why we would like, even if they can do something for us, it will be better for us to, as a certified nurse, if you see yourself, you have a pay slip.
All right, so awesome. We take a short commercial break, and right here we're having a discussion on the CNAs, as certified nurse assistants in our hospitals today. What's their role? And we've just heard that their numbers are not up to par. We're talking about the remuneration, which is a problem, but we equally recognize that our hospitals cannot work without them. Therefore, moving forward then, what is the clarion call to the county government and pretty much to the Ministry of Health? We take a short commercial break. We'll be back with much more right here on Health and Wellness. And welcome back. We'll continue the conversation right here on Health and Wellness. But right now, I want us to look at the 7 Ps of a CNA, even as we talk about the importance of recognizing their position. The 7 Ps that we talk about on what the roles of caregiver include prioritizing, protect, promote, provide proper resources and professionalism and partnership. When you talk about prioritizing, that would be prioritizing a patient that is in hospital, the work of that you do, protecting, ensuring that even when a patient is out of the theater, it is your role to ensure that they are wheeled safely, that they recover well, that their vitals are in check, that they're able to get back to their feet sooner. We talk about promoting. It is all about promoting what other facets in the medical field are doing. So that is the doctor, that would be the nurse. You are promoting the work that they are doing. There is providing a proper and resourcing. So all these things that are in place, clearly there is no way a hospital, say level 4, level 5, level 6 would work without a CNA. Where do you think there is a loophole when it comes to recognizing and appreciating the role of a CNA, if all these things that you've just mentioned are important and integral, not just to the healthcare of the country, but to number one customer, the patient. Where is the loophole?
Okay, well, I can say that concerning as certified nurse, the loophole comes that you see, we are not being recognized or we are not being seen because many of us, we call ourselves certified nurse. It's coming to be new.
Oh, wow.
It's coming to be new. Many people doesn't know certified nurse. When you say certified nurse, many people think that I'm a nurse. I'm not a nurse. We are having the difference about nurse and certified nurse. You know, these things we are doing, it used to be done by nurse.
Okay.
But it came by that we can make something called certified nurse. We can take tax for nurse. So you see, we are not being recognized because it's new. But now it's coming all over because right now, as we speak, the certified nurse is coming to be known in each and every hospital because the schools, the institutions, they introduce all over. They are introducing the work of CNAs, not only here in Kenya, even abroad. We are giving, you see, in TikToks, in Reels, in Instagram, different way. So people are coming to recognize that there are some people called in the hospital certified nurse who are caregiver. And when they come to go into details, they come to know that these are the people who are close to their patient. And that's how you find the family, they are worried. They are being told that their patient, as they enter the theater, you cannot see them until tomorrow. So they would like to take your number. They would like to say that, can we communicate about our patient condition? So that because you are the person which is easy to reach even to the family because you are the close to the patient. Yeah. So you'll be giving them the feedback, what is going on with their patient. So because you are the close, because they cannot reach through the doctor, they cannot reach to the nurses, but they can reach through me because I'm the one who's dealing with the patient most of the time after the patient has been given treatment.
You know, you've just mentioned something that is critical, I think, and that would be the brain drain that we continue to experience as a country. Why? Because you find a CNA who is important in the medical field today is not recognized. You know, many look at it as a new area. Rather, the county governments would say they see no need, you know, of, they see the need, but perhaps they don't see the need of investing into it as should be. Yet we see that many Kenyans are leaving the country and are doing these roles outside there, taking care of the elderly, taking care of the sick in hospitals because of their importance and critical nature and of the role that they do play, right? So are we looking, you can tell us, are we seeing many Kenyans with this profession leaving the country to go practice outside? And what can we learn? What message does that send? Not only to us patients, not only to us who would be patients, but to the government of Kenya as well as the county governments.
Okay. Many, they go abroad because of lack of job opportunity. So you see, like I was telling you, I graduated back then, 2021. My classmate, up to now, they haven't get the job. So what they think, some of them have lose hope, going to enroll another thing because they see that CNA, I cannot get the job. So they throw the documents away, they go for another thing to enroll. Some of people, or my classmates or some of the CNAs, they go abroad because here in a country, they cannot get the job because it's not easy to get the certified job. I can tell, it's not easy to get it. Even if you have the documents, it's not easy to get it. And so many goes, let's check in another country, let's check abroad, things like that. So that's why you see the agency, most of agency, if you go even to the page, they look about caregivers. That's why when they go for caregiver, they go for certified nurse. So many go abroad because our country doesn't offer the job. And that's why I can emphasize that the county should also employ the CNA because the CNA, they're playing good role in our county, not only here in Nairobi, but all over in our country. Because if they give them chance, they give the good health to the patient and they give smooth work to the hospital because we have to be there because we play a big role. I will continue to say that and I'll continue up to the end of the show that we are playing a big role in the hospital. I think you have been in the hospital.
Yep. You know, I remind, it's a story that I keep saying. I remember the time when my brother was very sick And at the time, that's when you get to realize the different roles that are played by different facets in the medical field. So there's the doctor who would come, there's a specialist who shows up once in a while. Then there is the resident doctor who's there to ensure the updates are there over time. Then the nurse there. Then the person who spent time with my brother for, especially during his last days, was the certified nurse, because the time when I used to call and everything, that's when you appreciate the roles that certified nurses do play. So yes, I've interacted with them. But one thing that I think it's important for us to stress out here is then the policy of the country when it comes to healthcare, right? Do we see the ministry recognizing the role of certified nurses? Are we seeing the government of Kenya putting itself and saying that certified nurses are important to our hospitals and we must give them their space to practice, we must give them the resources that they do need, and that the recognition that perhaps your career do deserve in the medical field should be given priority and importance? Are we seeing such conversations happening, say, from the national government through the executive, that is the ministry?
Okay, I can say yes for now, because this year, the new CEO in Mama Lucy Kibaki came with that I need certified nurse profession who has a document.
Yeah.
So many were there working the role of caregiver, but they have not gone for school.
Yeah.
So the CEO said, I need certified nurse who having the documents.
Yeah.
So I think the CEO knew that there's somebody called caregiver who is a certified nurse. That's why he find us that we have the documents and we produce them to the HR office. I think also because we normally take the patient to referral, like Kenyatta. We find there's somebody who has playing my role, the same role like me. We know, we discuss. How do you do things here? How do you earn? Are you casual? Are you PNP? Many in KNH, they are PNP.
Okay.
And you know, Kenyatta and Mama Lucy, they are different.
Yeah.
Mama Lucy is being stand by the county, and Kenyatta is stand by national government.
So is the problem then that county government, so two things. Is it that county governments are not recognizing you, or is it that they recognize you, just that they are not deploying the adequate resources to the fraternity?
Of course they know us, because for me I have a badge, which is having the badge it has a logo for Mama Lucy and the logo for county. So they recognize us, because sometimes we normally told by the child, this your contract is going to City Hall. So I think they know us. What I can emphasize that they give us job. Let us be in the pay slip also. Because us also, we are human beings and we have families. Because we are working there, after all, we'll be working there. Like I have some friends who have been working there more than 15 years. Now they're old. And you see they're old.
As a CNA?
As a CNA. But that time, they didn't go to school because the school was not introducing the CNA course. But now when they saw, they went for it and they enrolled. They have the document, but they work there for 15 years. You see, people are getting old. You don't have an SSF. You don't, such things, So you see, like the way even the economical life it is right now. You keep working each and every day. In the morning, you wake up and say, I'm going to work. By the end of the day, in my house, my family will need food. I would love to buy a land. But if we are not recognized, we get something small, I cannot access even the land.
You have nothing to show.
Sure.
I think, for me personally, I would look at it from a point of, we have the clinical workers union. I don't know if you know about it. Because one would ask, if you look at what the union, Kenya National Union of Nurses, right? You look at the doctors through KMPD, it is the unions that are pushing their agenda, and that is a voice that represents the nurses. So what then stops CNAs from forming their union and lobbying for these things to happen? Or if there is a union, is it that they're not pushing enough?
I can say we cannot say that we don't have a union. It's there, but it's limited. You know, the way I can say is that we are not recognized well as it's supposed to be done. You see, like a nurse is being recognized well because it's under union. Sometimes even you may find a nurse in an error, but because of union will fight for the nurse to retain the job. But for me, If something error happen, for me, going out of the job is very easy because we are not recognized. That's the thing. We are not recognized. And that's why I can say,
I think it's not that you're not recognized, you're recognized. I think it is the value that is placed on you.
Very true.
That then we would talk about, because like you say, you work at Mama Lucy, you are recognized because HR has your papers, you have a contract, just that it's not permanent and pensionable. So what then must Kenyans, what must the hospitals do, what must the leadership do to ensure that the value that you do deserve is given upon you? I think that's a good place for us to start from. So how then do we all have this conversation? Because let's face it, I saw it, and many other Kenyans see it, the role that CNAs do play. So how can Kenyans, everybody, be part and parcel of this conversation so that the value that you do deserve is actually bequeathed upon you? How can everybody be part of the conversation?
All right. What I can say is that definitely we work under Mama Lucy there as a certified nurse, as for me. And the rest, they are working in Margaret Hospital, that's a county hospital. Many hospitals which are being controlled by the county. Because they know that we are there.
Yeah.
What I can say is that they should come in and see the way they can help us. Even if they can put us in the contract, but we'll be in contract in under county, it will be perfectly. Because we have nurses who are in county, but not permanent, but under contract. You see, they are under union. Also, us, if you can be in contract, because we will be in the county, union can chip in now, recognize that we have CNS, and they see their roles, and they see the tax we are paying in the hospital. Because we play a big tax, and we should be recognized by the county. They should give us the job. We should not be played as the people that we don't do anything in hospital. We do a lot. We do a lot.
Yeah. So I think my question then would be, in the hospital where you work, do you have any CNA who is on permanent and pensionable terms?
Okay. Through my perspective, we don't have, because we know none. We don't have any pensionable or PNP certified nurse. We don't have. All of us, we are casual because we are in the same group, and we normally come at work at the same time, going home at the same time, so we are in the same group. Anything dealing with the office want to escalate something to us, they escalate to the group. If they want to renew our contract, they escalate in the group. We are one. We are just one, and we are casuals. No one is PNP.
If today, say, all the CNAs walked out of hospitals in Nairobi, the county governments, what would that mean to the health sector of the county? Because then we have to play a scenario. Say today, the CNAs decide we are not being paid well, we are not being appreciated, we're not being valued, and you walked out of hospitals today. What would that mean to the provision of healthcare to wananchi and citizens of Nairobi?
Automatically, it will be a problem. If we don't have CNA in the hospital, it will be a problem. The work will be heavy for nurse, for doctors. Sometimes doctors are pressurized by the consultant. The consultant came for ward round and said, I need this patient to be done MRI, I need this patient to be done ECG, I need this patient to be done echo. The doctor cannot will the patient. Sometimes the doctor, sometimes we find that he or she has a lot to do in the ward. He can take patient one by one to the imaging. So also even the nurse, you see, the nurse have to get the medication. Sometimes we have the patient who have time to be given the medication. Like we have 10 patients who are supposed to be given medicine, let's say at 9 o'clock. And yet you have a patient to be taken to imaging. It will be multi-tax. It will be heavy load for them because we are so you see, that's why I was emphasizing. Like we see that the time nurses giving medication, and this is the time for us. We're taking patient to imaging. We're taking the patient for bathing, things like that. We do the undressing, things like that, which we can do, we can manage. There's some which we cannot manage because we have different rules. We have big ones which it must be nurse only. So you see, and sometimes it's, what I can say is that we as a nurse, you see like what happened in KNH,
Yes.
the nurses went to strike. Who did the job there?
CNS.
CNS automatically. Because we are being trained. Sometimes we learn more. So you see the CNS were working there in KNH. Like they are given like these patients having headache. You'll be given a painkiller, just one, and water the patient to take the medicine. So you see, you do the tax for nurse because the nurse is not there. You see, and still we cannot say the work went smooth because we need also the nurse there because I'm not enrolled more than to learn about patient more. But nurse is more because nurse has gone for 4 years and is diploma or degree. And that's why you see, like you see in the, in KNH, the CNA cannot give birth to the mother because we are not under that. But we normally see things and we normally learn. But you cannot do that because my policy, I stick to my scope. I didn't learn to school to give birth to a mother, but I cannot do that. So you find it's a challenge. We need each other. That's why you see united in the hospital is the key, so that the work goes smooth. The hospital cannot work. Even the clinic they have right now, CNA. Even if you go outside there, a small clinic, you'll find a CNA, because the CNA is the cleaner there, is the one maintaining the clinic to be well, good environment, the clinic to look good, bed making, things like that. The doctor cannot make the bed making because how can you tell a medical officer to bed make? Of course, we are doing, it's calling. I have said that the job of the hospital is a calling, but sometimes it's like you are intimidating the doctor to tell the doctor to make the bed. Yeah, it's not the work for doctor. That's our work. That's our work, to make a patient to look good. And that's why you see patient love so much the CNA, because whatever I give to patient, so much happy, because the patient said, my clothes is dirty, I need another one. I would rush and bring another one. The patient will be happy with me. Sometimes the patient said, I'm not full, can I get food? You go and try the way and bring the food. The patient is happy. You see, the patient sometimes said, I can't see, can you buy for me a credit on my phone? Can you try to buy for me credit? You make that bold with the patient.
Yeah.
So I can say that the hospital nowadays, because things are going different level, the hospital cannot run without the CNA. The CNA must be there. The CNA must be there.
You know, you mentioned something as buying data, credit. I don't have credit. It is CNA who do that. And then this brings the connection between a patient, the CNA, and their families. Because earlier you alluded to the fact that even when Kenyans leave their patients in hospital, right, they've left them in the hands of the hospital, but it is the CNA who is the connecting link between the family and the patient. And that then goes to speak to Kenyans out there and recognizing the value that you bring on the table. And while that is the fact, right, because you mentioned that there is need for better remuneration, and this only has to work in a structured way through a policy paper, through proposals out there. So as CNAs working in Nairobi County, I just want to ask, is there then anything that you're doing together as a policy paper, as a proposal to the county government to this, which would be an equivalent of a CS in the county? Are you having this discussion so that we can finally have structured conversations with the county to answer this matter? Because as Paul, you'll come and speak, right? But if it's a group of individuals speaking together and presenting a document, there is weight to that. So are we having those conversations among ourselves on how we can make it better? Because as a Kenyan, I see the value, you know, and if we as Kenyans, if we as patients see the value, the county sees the value. The reason why you have a name tag, the county recognizes that you're there. The national government recognizes the value of CNAs. So are we having these discussions then with the national government and with the county government in a structured way so that everything else can be handled?
Yeah. Let me go back again what I said in your statement. When I say the Green Army were employed permanent.
Yes.
You find, I'm not discriminating, but some of them, you see, they have not gone for school for that. For me, like my parents.
So that is at KNH?
not Kenya, I'm saying the Green Army. I'm talking about the Green Army, which were employing permanent. Many of them, you see, Sakaja gave them the paper, the payslip, vijana na payslip. I myself, I texted Sakaja, Governor Sakaja, and I told that also you should recognize us. Also, we are there and working under the county.
What did he say? Did he respond?
He didn't respond, but he blue tick. I saw blue tick. So I just was like, but already my request reached ilifika kwake. So what I was emphasizing that the way walikuwa na recognize the same case, even us as certified nurse, they should recognize us in terms of we having papers, we have gone to school. Like, you know, the CNA is expensive to learn. If you go to school, it's above 200,000. 200,000. Yeah. And we also, the institution takes serious, because if you fail exam, you have to have the retake. The retake, one paper is 1,000 and paper is 17. Exam papers are 17. If you fail of them, you'll pay 17,000.
17,000.
So it's serious. It's not something that we went for free and we enroll and we come to the hospital. It's something our parents or us, ni kujinyima, ukasema vile pesa unajipeleke pale shule ufanye nini? Usome na uhitimu. So unapata watu wengi tunaumia in terms of CNA wengi wana kazi because set hospital kuandika, because we find the hospital wamesema acha tukue na number 20 CNAs in the hospital. So they cannot employ, even if they need more, they cannot employ more.
If you're given an opportunity to speak to the county government, speak to Kenyans, speak to the president, speak to the minister, cabinet secretary, Eden Duale, what would be your message?
Thank you for that opportunity. I can say that if I give given an opportunity to talk to the CS, what I can say is that they look on us, they check on us. We are also Kenyans, we are citizens of this country, and we love our country. And that's why we do what is taking care of a Kenyan citizen person, not only a Kenyan citizen person, because Kenya is a East Africa referral. So we do a lot. They should look on us also. Just the way they look for others, also they should recognize us, because right now we can, as a CNA, we cannot work in the hospital without not having those documents, because the government will come to check in. If this person is qualified, let the documents, they know, they see. So they have to take even serious on us also to give us opportunity. Right now I can speak. I'm 23 years old. I have family, I have a wife and I have one kid. And you know the CBC is strong. I cannot say amount what I get, but I can say, don't look the way I'm looking. Nikujinyima ndo smart. But we are going through a lot and we suffer. But we suffer inside our heart. We cannot complain outside because we fear for our jobs, for opportunities, which we have been given where we are working. But the government must look about the CNA, the certified nurse. We give to be given opportunity to work in the premises. At least also us, we be in the pay slip. We be on the part of the pay slip. We'll be happy for that. Because I know this government is government for projects. Also, they could put us in the project.
As a project.
Yes. Even us, we'll be seen as a payslip. We'll be happy for that.
Be happy for that.
Yeah.
I mean, you see, when you talk about matters to do with healthcare, it's different facets that come together as a combination. Many would want to call it a combo for it to work. So here we are talking about doctors, and in that as well, we have specialists, we have nurses, and then there is the cadre that is the certified nurse assistant who comes in to complement all the others to ensure that the patient, who, according to Paul, is always right, the patient is always right, gets the best service that they do deserve. And again, let me just remind you of the roles. Here we're talking about the 7 Ps of a certified nurse assistant. So include prioritizing, protect, promote, provide proper resource and staffing, professionalism and partnership. And all that they do require or are asking for is that the county government, national government recognizes their role, including the patients, you and I, so that they're able to serve you even better. Nothing much to add on to that, but to say asante sana to Polo Tange, who is a healthcare assistant, certified nurse, and a caregiver. And right here on Health and Wellness, we celebrate all of them. Here we say we give you your flowers. We celebrate you for an amazing work that you do. And even as the county government continues to listen to what it is that we say, Kenyans, let's come together, because imagine we cannot do without certified nurses in our hospitals. I'm Dennis Aseto. This is the Health and Wellness Show, coming to you every Sunday, 6 to 7 p.m. Until next time, adios, bye-bye for now.